Good morning, my friends. We're very happy to receive you at Ifakara Health Institute. I've understood today that you have developed a very good algorithm to replace, or rather to complement, the efforts that we have now for childhood illnesses. Could you just describe what this program is all about, briefly?
Okay, so this is an effort to try to help clinicians working at primary care facilities to handle patients with fever appropriately. That means to have a better clinical outcome, but also a more rational way of prescribing our precious medicine like antimalarials and antibiotics.
Right, and so far, what are some of the findings that you have?
Yeah, so the algorithm itself is an electronic tool, so it's a smartphone-based tool that clinicians like Samaka will use, and it helps them to guide them through the consultation process. So we'll ask a couple of questions, like any clinicians will do for clinical science, suggest lab tests, and then provide classifications and treatments, while maintaining that integrated approach of IMCI, which is very important. And we did compare that. Samaka was part of the study in a clinical trial in Dar es Salaam, in 9 health centers, where we compared this tool to an IMCI-based tool, and we've actually found that it improved clinical outcome of children with fever while substantially lowering antibiotic prescription.
Yeah, I mean, one of the biggest problems that we have here is that a lot of children receive unnecessarily a lot of antibiotics for even in cases where they shouldn't. And you have demonstrated that you can reduce this by almost a third. Could you just tell us a little bit more?
Okay. First, I can say that the electronic version is very user-friendly, so it guides you how to treat the child. And with specific investigations and specific treatment, it really reduces the antibiotics management in children.
Right. So
one of the challenges is that clinicians don't have diagnostic tools to decide, which child to get an antibiotic. And there's a lot of fear of missing bacterial infections and, harming children of not prescribing antibiotics, missing that one child among the 20 you might see in a day.
Yeah.
So we thought it was important to give them a tool at hand to empower clinicians to prescribe, to target the children that actually need antibiotic prescription.
And with this new tool, overall, the quality of care also goes up. Is that correct?
Yeah, the quality of care at short term goes up because children are less exposed to this antibiotic that destroy their immunity also in the intestine and has a lot of side effects. And on long term, it impedes the development resistance, and that the antibiotic will not work anymore in a few years. That exactly like we had the problem with antimalarials.
I saw in some of the data that you presented today that kids as young as 18 months, in some cases, have already received antibiotics 11 times. And this is a problem that should be history if we can implement the e-POCT tool that you have developed. Is that?
Well, we hope. I think there's a lot of things that go into antibiotic prescription. It takes many things to change. But one important thing is that clinicians can feel comfortable in the accuracy of the tools that they use, so they can feel comfortable in the guidelines that they use. And I think that is one of the key factors. And maybe Samaka, you can talk a little bit about all the other, the symptomatic treatment that is important for a child that is often skipped because you prescribe the antibiotic. You focus so much on the antibiotic. Maybe you can tell a little bit about your asali.
The asali.
Yeah.
Let's say asali. Let's go to a patient with cough.
Right.
When a child comes to you, as we do previously, every clinicians do, when a child comes with cough, they usually just go straight to the antibiotics. But that's not it. Take the history properly, examine the child properly. You might end up just giving this child paracetamol tea with honey.
Fantastic.
Yes. Because the child will not be having normal, be having just a viral infection, which will just phase down within 3 or 4 days, that's all.
Brilliant. So overall, what do you guys think should be the next steps with this new tool? Are you promoting it to get the Ministry of Health to take it up? Are you scaling it up, or do you still want to do further studies?
We want to connect with the Ministry of Health and also to all the e-health efforts that are done worldwide in Tanzania. So the idea would be to bring the tool in a few settings that are a bit different Dar es Salaam, to check if it's also valid in a more rural place, and also the feasibility. How will the normal clinician pick it up for their daily work, and what impact we have in a real condition? That would be the next step.
Oh, brilliant.
What we've learned from IMCI is the countries where scale-up has worked is where government was at the core of the implementation process. So I think, as Valérie mentioned, involving government early on, because we're sort of in the pre-scale-up phase, where we're not going tomorrow and implementing it in 100,000 health centers in Tanzania.
Right.
But to really involve them early on in the next step of research, I think is going to be key if it's supposed to be sustainable.
Right. I mean, I just want to say that we at Ifakara Health Institute are very proud of this partnership, and we look forward to continuing the partnership with you guys. And it's really, really amazing to see that you're already making so much impact, even in the small facilities that you've worked with. Already you've, directly impacted on close to 2,000 children in these facilities, and this is something really, really nice, and we wish you very well. And once again, thank you for your time today. Really appreciate it.
And one more question to Valérie, please.
All right, brilliant. Go ahead.
Please. No, you are.
Please, one more to Valérie.
All right. So, Valérie, I'm asked to ask you the last question, and if you don't mind, in terms of the healthcare support that the children in Tanzania get today, how confident are you that we are going to reduce the child mortality much further than we have achieved in the next few years?
I think if we continue with initiative like that, targeting the right children with the right treatment, we
Right.
will continue and be able to continue to decrease the mortality, obviously combined with preventive measures
Right.
that can decrease exposure of children to infection.
So there is a lot of opportunity to complement the tool that to use the tool that you've developed to complement the existing processes.
Exactly. It's really another place where we can have impact. On one side you have the prevention, you have the treatment, but the diagnosis, which is really the decision to take when you treat the patient, is also an extremely important component that has been a lot neglected up to now.
Brilliant. Thank you so much. Appreciate it.